Hey guys! Hey, good to see you again. This is going to be a special video that I'm doing per request by one of the followers on Instagram. It was a request by Miss Shaymona. So thank you, Shaymona, for sending me a request. She asked that I would do a video on what is in my nursing bag. What should I bring to work, and what do I need to have to feel prepared? And it's a great thing to ask because, you know, as a nurse, we're always running around. We're doing 20 different things at once, and it is great to be prepared at work. So thank you, Shaymona, for asking that. And if anybody else ever has any requests or suggestions on what they would like to see, please let me know through Instagram, through Twitter, through however you feel. I have all of contact information and links and everything like that down below. So I'm going to be completely honest with you guys. I don't have everything that I normally have in like my nursing bag with me right here. I have some stuff at work. I have a personal locker at work, and I know a lot of hospitals will do this, and I actually keep a lot of stuff in my locker. That way I don't have to keep bringing it back and forth from home to work and work to home and everything like that. So if you have a locker, if you're going to have access to a locker, I highly recommend keeping everything that you need for work, or as much as you can, inside that locker. First of all, obviously I'm a dude, so I'm a Murse, so I don't have those real floofy, you know, female bags. I just have a normal backpack. This guy has been with me all through nursing school and even a little bit before. It's pretty sturdy. It's actually, I think I'm pretty much ready for a new bag at this point, but it has done me very well. So if you're just going to get like a backpack like this, it's very casual. You can throw it on your back and everything. Make sure you get one that's pretty sturdy because you're going to be putting some stuff in there, and you want something that's going to last. You don't want to have to be buying a bag. For starters, let me open this guy up. Probably common sense, but obviously you want, I'm already losing stuff. You obviously want to have really good writing utensils, which includes a pen. I know pens and pencils can be very valuable, and so you really want to have a nice writing pen at work, but if you have any experience in the hospital at all, you know that people will jack your stuff at a moment's notice, and you will never see your favorite pen again. So I don't recommend bringing your favorite pen to work. I don't mind scribbles, but if you're like real anal retentive, you might want to get a pencil or something. So also, you want a, you know, maybe a few highlighters. These are really good for highlighting information on your brain, if you're doing the brain thing. You know, like I said, I have a few different ones in my locker. If you're really super organized at work, you can do a few different colors like I do, but just something, I usually just use one at a time. In my hospital, in every patient room, we have care boards. They're called care boards, and that's where we write. They're like whiteboards, and that's what we use to write all our names up on the board at the beginning of shift. So like the nurses' assistants, the RTs, the nurses, the doctors, and whoever else is taking care of the patient will write their name on the board, and so I always make sure to have a dry erase marker. That's really important. Along with that, I have a Sharpie. Just a standard Sharpie that's going to be good. We're always dating, initialing, and signing whatever else, dressings for the patients, and so it's really nice to have a good Sharpie, reliable Sharpie on you at all times. Of course, you need a pen light for doing your neuro assessments and everything like that, checking pupils. I keep a couple extra tools. I keep a pair of hemostats. The clamping things, you can kind of like pry off tubing lines and caps and stuff like that, among the many other things. Trauma shears. In a critical care unit, we get a lot of admits from the ED. These are really good for like cutting difficult types of tapes and like, I don't know, whatever else you can think of. But trauma shears are really good because they can cut through like basically anything. Of course, stethoscope. I just have pretty basic Littman, you know. as a new nurse, as a new nursing student or whatever else, don't try to get one of those super fancy things for cardiac stethoscope or something like that. You're learning, you're not going to be able to recognize heart tones or heart sounds or anything crazy that's not a normal sound anyways. So just get a basic stethoscope. I always bring my water bottle. My strap is kind of broken, but I always bring a water bottle to stay hydrated. It's really kind of difficult for us to do that at work because we're always running around, but I always have this. Of course, Mojo, Murse Mojo. Gotta have your favorite coffee mug. I actually have in my locker an extra toothbrush and a tube of toothpaste that I can use to just kind of freshen up. It's not actually nursing related, but it is good to have like as a nurse. You guys might think I'm a little bit ridiculous, but I don't care. Judge me. I actually have one of these neck things that people wear at the hospital. I have this, carry this in my bag. Because during those the half hour that I get for a lunch break, sometimes I'm exhausted, or for those night shifters, I've done night shift, you just want to take a nap instead of eat. These are really nice because you can just rack out in an empty room and pass out. You don't need to use like a patient pillow or anything like that. So I kind of just like to have these. This is kind of like a memory foam type material. It was like, I think $10 or something like that. So it's, you know, for something like that, I think it's totally worth it. So, something to consider. I think it is super important to have a set of earbuds. Now, preferably it's ideal to have a full set of earphone, like the head earphone, what are they called? The earphone things, whatever they're called. But earbuds will work. The reason I have these is so I can focus on charting. When you just need to close off everything else that's going around you, you need to focus on your charting. You can actually start to hear like call lights go off on this, and so I really need to get some new ones. Your subscription to a research journal. We all know that there's those RNs and doctors out there that think they know everything. That think they know everything, so when you're catching them in a lie, because you read up on this the night before, you can say, ha! No ma'am, nope, I read it. Nobody likes to know it all, okay? You need your own scalpel. In case your patient needs some sort of emergent procedure, you need to have a scalpel, and now I know I'm not promoting you take anything out of your hospital unit. We don't steal, but this is something that I picked up at a craft store, so I highly recommend getting one of these because you never know when you're going to save a patient's life. Can opener. Sometimes we get those patients that are like just, they stink, they're really dirty. Just buy some vanilla extract. This is vanilla extract. You can pick this up anywhere at the grocery store. This helps to cut down on the smell, makes your room smell really nice. The patient's families always love it. And if you know, you have some confused patients that try to like eat it, it's okay, it's totally harmless. I usually just spray some of this on the patient or wherever the source of the foul odor is, and just make sure that everybody else knows that it's vanilla extract, because it will stain the linen and you don't want to confuse it for like diarrhea or something, and get rid of the smell, the nice smell of the vanilla, and replace it with the bad smell that you're trying to get rid of to begin with. And I think I have some other stuff. Cayenne pepper. This is really good to have. The thing that I have found I use this the most for is for those really combative patients. I give every patient one opportunity to listen to what I say with restraints on. That's the important part. If they don't behave, and if they start getting feisty again, then I just put a good palm full of this stuff in my hand next time I go in the room. Right in their eyes. It's pretty much like mace. Ultimately, it comes down for patient safety. I also have a cheese grater. These are really good for those really dry feet. And patient hygiene is really an important thing, and so you want to have a good one. Just lay into the foot. The heel is really a commonplace thing. So some other things that I keep in my bag. Charcoal. vodka. I wouldn't worry about taking shot glasses. You can usually just get like a medicine cup or something. They do the trick. Glitter glue. This is wonderful. I love using this. This is kind of like in a burnt orange color, just my school color. You can get it in any color that you like, but what I like to do with this is just spray it all over the patient and then wipe it off. And they have the most gorgeous sheen over them, and when the doctors come in, they look amazing. You guys, you will not believe how fast you can get your patients discharged. Hold on, guys. Yes, Super 77 multi-purpose adhesive. This stuff is amazing. I don't know what I did without this. So when you get those dressings that just don't stick to your patient, they're really diaphoretic, they're sweaty, or they just move around a lot, you get some of this stuff and you spray it on, that bandage will stick to that patient for the rest of their friggin' lives. Inflammable properties, with the warning, I found that doesn't really apply to the hospitals. Bring it into the patient's room itself, and I found that a really good spot to store this for the day is just right by the oxygen connections on the wall. So, a guitar. Music therapy has been shown to really do wonders for patients as well when they don't have their own CD player or personal band to follow them into the hospital. So, a piano, a keyboard, tambourine, anything that's just going to cause noise distraction for the patients. Usually around like the 4 a.m. Assessment is usually the best time that I've noticed that you can just come in and play some nice little notes for your patients. It helps with sleeping, and I think the whole unit will thank you. It's always really important to have a gas mask. Always remember that when you're doing your inspection checks, you need to cover the filter and check for that seal, because you don't want to smell anything when you go into that patient's room. Also, isobutane propane fuel mix. This is pretty self-explanatory. I don't think I really need to go into detail there. Bear with me, guys. We're almost there. Condoms. I don't know why these are in there. Well, sex education. It's always good to be prepared for sex education if you're working with adolescents. I don't know. I can't believe I almost forgot this. Cannot go to work without this. It is a can of Play-Doh. This is like a nursing essential. Don't get too caught up with the color. What really matters is the container size. 5 ounces is the standard. You might as well turn in your license if you're going to work without a can of Play-Doh. Okay guys, well, I think that's it. So, like I said, this is only just some of the stuff that I normally bring to work. I'm sorry I couldn't get everything. Leave some comments below, like, share, don't forget to subscribe. And again, if you have any suggestions or requests of what you'd like to see in the video, please let me know and I will do my best. Thanks for tuning in, guys. I hope this was helpful, and I will see you soon. Bye.